Hello everyone, my name is Dr. Lin Lei Lim and I'm an infectious diseases physician at the Victorian Aged Care Response Centre. You'll be asked to go into quarantine if you are close contact of a COVID-19 confirmed case. You will need to remain at home, and after 11 days you'll be asked to have a COVID test. Your quarantine period will be complete after 14 days, provided your COVID test is negative and you have not developed any COVID symptoms over this period. You'll be asked to go into self-isolation if you've had a positive COVID test. You'll be required to remain at home whether you have symptoms or no symptoms. Your isolation period is completed at day 10, occasionally longer if you are at least 3 days symptom-free by that stage, and that includes symptoms of fever and respiratory symptoms such as sore throat, cough, shortness of breath, and runny nose. Your clearance will be provided by the Public Health Unit, including clearance to return to work. The important thing is to recognize that there are some simple ways to protect your family. Ideally, you should stay in your own room with your own bathroom if possible. Try to keep the door closed as much as possible. And if you do need to open a window, make sure that it opens up to an area with that's not a common pathway. As well, it's important to try to keep the number of people coming into the room to help you to a minimum. And if they do need to come in, they should wear a mask and perform hand hygiene before and after they leave the room. When you leave the room, try to use a face mask if available. If you do not have one handy, try to use a cloth face covering. It is important to wash your hands with soap and water or hand sanitizer, especially when you leave the room. When in the kitchen, keep your crockery and utensils that you are using separate with the rest of the household and wash your own sets yourself. Household members should regularly clean and disinfect areas that are commonly touched by members of the family, and this includes areas like keyboards, taps, door handles, and kitchen top surfaces. Dispose of your tissues and masks in a sealed bag to be disposed of. And obviously, given that you're in quarantine, no visitors are allowed in your home. If you have recovered from COVID-19 infection, you are immune from the infection again. However, given that COVID-19 is a new virus and we are still learning things about it, what is not fully known is whether the immunity lasts for 12 months, 2 years, or 3 years. It is important that you feel safe and comfortable on your first day back at work. I would suggest that you speak to your supervisor beforehand to ask them where you turn up on your first day to work, who the support person will be to help reorientate you to the facility that you're working at. And you will also have the opportunity to undertake refresher training in PPE donning and doffing prior to that first day. You'll be shown where to store your personal items and also the area where you can have your tea breaks. You will also be shown the different PPE that's currently being used at your place of work. So there may be some different styles and brands that you may not be familiar with. It's important to take your time and choose PPE that you feel comfortable with, that fits you well. It is important once you start working to ensure that you remain well hydrated and to have regular breaks. One important thing to consider is how you'll manage your work clothes and work shoes. We would recommend that you have dedicated work clothes and shoes that you wear to work, and then you change out of those work clothes either at the end of the day or at home immediately once you get home. With the work clothes, you can put them in the washing machine. There's no problems there, but I would recommend that you put it on a hot wash with detergent. With respect to your shoes, leave them at the front door once you get home. You do not need to do anything more than that, but don't wear them around the house. Thanks for watching. For more information, see the Australian Department of Health website, health.gov.au.